everybody, and welcome back to the Dr. Mike and Shannon Show. I'm medical technology specialist Shannon Fanenstein, representing Mazan Medical, the Uraval BRS. And joining us is Dr. Mike Bradley. Dr. Mike Bradley, please go ahead and introduce yourself for those who are new to our show.
Hello, I'm Dr. Mike Bradley. I'm the Chief Medical Officer of Mazan Medical, and I'm happy to be able to represent the bulbocavenosa reflex system, the Uraval, that particular company represents.
Great. And so today's question is, we've had this come up with our urologists, and they've been very excited about the fact that we follow what they call the Merck guidelines. Can you briefly talk about what are the Merck guidelines for those who aren't familiar with them, especially for our medical providers out there, and why are they important?
See, the Merck Manual is one of the things that we use in medical school, and it's an internationally identified way of being able to kind of understand what we do in different medical situations. They talk soup to nuts, everything medical, and have since I think it's 1890 or something like that. So it's a very, very well-known group of papers, processes, and guidelines that help medical professionals do things the way we're supposed to, that we're all on the same page as far as when we see a particular medical based, problem. This is what's been based on, proper research. This is the way we address it. So the Merck Manual has this incredible topic of conversation, which is incontinence in adults. And so recently it was updated as of, I believe it was September of 2022. That was the most recent update for it. So it's relatively new. But in the guidelines, they specifically talk about how with an adult with incontinence, one of the first things you're supposed to do is evaluate whether or not there is neurological issues or not. And I'd love to be able to share with this, just reading off specifically what it says. From these guidelines from the Merck Manual on exactly what we're supposed to do, if that makes sense.
Yes, and that would be great. So that way, those of you who aren't familiar with what these guidelines are, without having to do, we will provide the link in the description. But let's go ahead and talk about what are some of these guidelines, because this falls right in line with what we are able to do with the Uraval BRS.
So the first thing that I'm going to do is give some very correct details based on the Merck Manual, and this is available online, and we will put the link on our description page so that you can access it as well. The specific title is urinary incontinence in adults, and it has a whole, like on the professional version, which is those of us in the medical industry are more interested in that. There's actually a patient education section. So if you're not a doctor or medical provider, there's a great little way to be able to link on or to click on that page that talks about from the patient's point of view what they should expect when looking at urinary incontinence is what we would do as doctors to evaluate, treat, and the key points of those things. But I'm going to stick to this topic of conversation on more the professional end, so our providers out here can understand where we're coming from for bulbocavenosa reflex testing and how it applies in urinary incontinence in adults. So the article that I'm looking at specifically is urinary incontinence in adults. It was modified most recently in September of 2022. So this is very, very new. And it was by Dr. Patrick Sheenot, who is a very, from his profile, very, very well-educated person in not only urology, but neurourology as well. And he does a lot with pelvic floor. So one of the things that I want to point out in this is it talks about a lot of different things, but the thing, of course, that we're most interested in is the evaluation phase. So when you're looking at this and you go down the paper, evaluation is about the second part of the article. And the first thing that comes up is history. So you're looking for the history, of a patient. That's a very common thing that we do when we're looking at our EHRs is we're looking for history. We're looking if they've had problems in the past. Are they using pads? Are they soaking those pads? Have they done avoiding diaries and those kind of things? We're just trying to get an understanding of what brought this patient to this point. And in that, what I think is very interesting in the evaluation phase is it talks specifically about how most patients are embarrassed to mention incontinence. They don't volunteer this information readily. They may also not relate symptoms like frequency, noctura, and hesitancy. And I'm reading this directly off the paper, by the way.
And these are men and women, and yes, they often won't talk about it, but they often don't know because they think these are things are normal.
Right. The conversation about incontinence is scary to people. Oh, I'm not incontinence. But do you get up to the night to go to the bathroom 4 times a night, 3 times a night, 2 times a night? Yeah. Well, that's under that same umbrella in a way.
And they don't realize the signs
It's,
exactly.
yeah, it's exactly. And then, a lot of times there'll be a screening question that says, do you ever leak urine? We at UNLV actually have a screening questionnaire that specifically talks about how often you get up at night to go to the bathroom. 0, 2, 3, right?
Yeah, I would fail your questionnaire.
How long do you have to be able to get to a bathroom once you have the urge, right? When you're driving in a car, do you look for the cleanest bathroom or do you look for any bathroom, right? It's so
Can
funny.
you make it through a movie? Just
Yeah,
like we talked about the trampoline, the car
exactly.
ride, and
Right.
the yeah.
Yeah, that's exactly right. It's a part of our other videos that everybody should watch, that is watching this video. But one of the things it goes over the history, sleep-related problems, those kind of things. But the very next thing it talks about is the physical examination. And the very first line on the physical examination of the Merck Manual involving urinary incontinence in adults is, and I'll read it, neurological, pelvic, and rectal examinations are the focus. And the bulbocavenosa reflex is specifically tied to neurological examinations with the symptoms of fecal incontinence, urinary incontinence, and sexual dysfunction. Those are the 3 primary key points when we do one of these tests. And it goes word for word, guideline for what the Merck Manual is talking about to us. So it specifically talks in here on the second paragraph, and specifically the third gives these nice bullet points, right? And in the bullet points, it says interventions of external urethra sphincter, which share the same sacral root as the anal sphincter, can be tested by assessing. And if you remember the bulbocavenosa reflex, the Urival assesses. We don't diagnose, we assess.
Right.
So we're right on line with this. Perneural sensation, violational anal sphincter contraction, that's the S2 through S4. The anal wink reflex, S4 to S5, which is the anal sphincter contracting.
Which, if you saw our other video, it's the oddball winking at you.
Yeah, the winking video. It says it right there, anal wink reflex, S4 and S to S5. And then the very next one is the bulbocavenosa reflex, S2 through S4. So, and then it talks about pelvic examinations in women, rectal examinations in men. This physical examination is the first step, if you will, in this process of both evaluating urinary incontinence in adults and ultimately treating them. They get into treatment and they get into some of the other, urodynamics testing, which we talked about on one of our other videos. Some of the different things they're going to do to assess and evaluate why you're having this incontinence. But in this Merck manual, the very first thing you should do right after getting the history of the patient is, per this, you should do some form of neurological testing. So I feel like it was worthy of us to, for lack of a better word, discuss this, because this is the manual that we use when people talk to us, hey, what are the guidelines on this? Where do we come up with the guidelines to follow when we're dealing with an adult with, urinary symptoms or incontinence? And sure enough, you go right to the source, and it talks about how the neurological component is very important and should be the front line of this assessment of the rationale and why patients are having this problem. Now, it doesn't, of course, say specifically Urival. That's a system that's used to test what they're recommending that you test for. But the bulbocavenosa reflex is directly mentioned in this conversation. Now, of course, go ahead.
Oh, go ahead. Well, and the one nice thing when we were talking about how they're or what they're assessing is then also to come back to how are they doing that assessment? Because again, yes, it's very important to do that assessment, but do we have something objective or do we have something subjective?
It's
So
exactly
it's
what
a
I was
big
going to talk.
difference there. And we have a way to have we have a way to have actual data for somebody to be able to take a look at.
That data allows for us to be able to determine, based on white papers, whether or not a treatment protocol of Botox, for example, is going to work or not. Whether or not a urodynamics test. It's funny, it actually talks about this in the Merck manual, in that article that we talked about. It specifically talks about neurological issues, non-neurological issues when it talks about urodynamics, and it gives a chart flow difference of the rationales on what is probably the reason that they're having these incontinence issues based on it being a neurological or non-neurological issue, which means if you're not testing for the neurological issue, you're still kind of guessing at that point. You're very subjective versus what we want to be, which is objective in our process flows.
And
So
how valuable of a tool would this be for a provider to be able to actually have that measurement? And now they can go in, they have the Merck manual or they have the guidelines they're following. And now they can go through and be like, oh, I already know this isn't going to work. I already know this isn't going to work. I mean, between the patient and provider, I mean, it's just extremely valuable tool.
I think it doesn't necessarily tell us what to do, but it probably steers us away from the things that wouldn't work based on
Right.
neurological or non-neurological. And more importantly, based on how bad the damage is. That's one of the things that I don't think we've got enough time to talk about. But the bulbar cavernosa reflex, they measure it in millisecond time. That's that latency time. And the longer latency, the longer the delay, the more the nerve is damaged, because that's what's having the problem with the reflex. And it's, if the reflex is longer, that shows a more severe damage situation. And there are directions you should go based on the significant difference of time of a normal or abnormal latency. If you do it subjectively, where you're doing a manual test, or just guessing, you're really making a mistake, I feel, when you have the option to be able to get true data and true numbers, and from that make true and better clinical decisions. So
And this is great information that you're providing with us, because this is something that we have been trying to get more out to scale for the providers to understand that, yes, with the Uraval, with what we're providing for your practice, does follow the Merck guidelines. And we will be getting into a discussion with Debbie Folkerts, our inventor and founder, about different diagnosis, different patients and these latency times, and the surprises that you may find with these patients. One that was in his early 20s who had an injury due to playing football, or one of our female veterans who was injured in Afghanistan, how significant her latency time is. So we're going to be discussing this in further detail. We will be putting a link in our description for the Merck protocols, the Merck guidelines. And we thank you so much for being a part of our show today. Any last thoughts, Dr. Mike?
well, I think we're going to obviously put that link in there for our professionals, our providers that are working with patients with incontinence, and some of the other things I talked about: hesitancy, nighttime frequency, those kind of things. But if you are a patient and you click that link, there will be a little red thing that says patient education. So if you want to know from a patient's perspective, a much easier to understand viewpoint of some of the things that we're doing, I highly recommend you going in there, clicking that, and you'll get a great understanding of kind of the directions that we can go to be able to help with the very embarrassing problem of incontinence. So again, I want to be an advocate for our providers, but I also want to be an advocate for our patients too. So that's our goal in this. But other than that,
And we thank you. Yep. And we thank you again. Please don't forget to like, subscribe, and share with a loved one, share with a family member, share with a friend this information, especially where they can go and be able to read that paper. Thank you again. Have a wonderful day.
see y'all. Bye-bye.